We are now breaking in to bring you a special COVID-19 update from the Georgia State Capitol. The governor and his team are speaking ahead of the Thanksgiving holiday when more than 1 million Georgians are expected to travel. Let's listen in.
GEMA Director Chris Stallings, our Insurance and Fire Safety Commissioner General John King for being with us today. With Thanksgiving just being 2 days away, we want to provide an update to the people of Georgia on where we are in our fight against COVID-19. But also remind them to stay vigilant as we head into not only Thanksgiving, but this holiday season. On the good news front, the state continues to maintain an ample supply of PPE that can be deployed at a moment's notice to support our frontline workers and healthcare facilities. As of yesterday, we continue to have between 45 days and 2 months worth of supplies in each of our primary PPE categories, which includes masks, gowns, face shields, gloves, and other critical supplies. We've shipped nearly 8 million masks, over 287,000 gallons of sanitizing gel, more than 19,500 hand sanitation stations, and 52,000 face shields to our schools to ensure a safe return to the classroom. We are also prepared to support our local partners in the coming months as we continue our response to COVID-19. In recent weeks, we've been in constant contact with hospital CEOs throughout the state to maintain an open line of communication to hear what they're seeing on the ground. The state continues to keep hospital and long-term care facility staffing as one of its top priorities in responding to COVID, and we continue to work with Commissioner Frank Berry and the Department of Community Health to shore up staffing resources through the end of the calendar year to support our hospitals as well as our long-term care facilities. By the end of 2020, we plan to allocate a total of $250 million to staff augmentation alone. The Georgia Department of Public Health Commissioner Dr. Kathleen Toomey and the Georgia Department of Insurance Commissioner General John King and their teams have been working very hard to put together a comprehensive plan for vaccine distribution. We remain encouraged at recent developments on the vaccine front from Pfizer and Moderna, and our team has been meeting regularly for months to ensure that we're prepared to shore and ship the vaccine. I want to take a minute to commend the Trump administration and Operation Warp Speed on really an incredible work on the vaccine and how they have been able to get this vaccine ready in historic and record time. And I know that Americans and Georgians are ready for it. And as soon as that supply is ready to be shipped, the state will be ready to deploy a safe, effective vaccine. We'll also be providing updates in greater detail on our vaccine plan in the coming days. However, today we want to focus on the Thanksgiving holiday. We all know as the weather continues to turn cold, more people spend time indoors, and we've seen a rise in Georgia cases in recent weeks. In light of that, with not only Thanksgiving, but Christmas, Hanukkah, the New Year, and other holiday celebrations right around the corner, we're asking all Georgians to continue to do a few simple things to help limit the spread of the virus. The 4 things for fall that we've talked a lot about: wear a mask, practice social distancing, continue to wash your hands, and follow the guidance of our public health officials that we have outlined in our executive orders. And I know that Dr. Toomey would be very upset if I didn't mention the 5th point, and that is, if you have not done so already, get your flu shot so we can do our part to prevent a twin-demic of COVID and the flu happening at the same time. I know, like you, many are looking forward to spending time with their loved ones over the holidays. I am too, but I will tell you, we have to continue to remain vigilant. If possible, consider gathering virtually or limiting your holiday gatherings to only a few people within the same household. If weather permits, see if you can gather outside to reduce the risk of exposure indoors. If you are traveling, Take extra steps to socially distance from those you don't regularly see. And please, if your loved ones are more vulnerable to COVID-19, especially the elderly and those with underlying medical conditions, consider their risk of including them in our holiday gatherings. As I said over the weekend, our fight for COVID-19 has uprooted many of the norms that we're used to, especially during the holidays. I know that people are frustrated and ready to return to normal. I am as well. But we cannot grow weary. We have to keep our foot on the gas in this fight. And as we celebrate Thanksgiving on Thursday, I think we all have plenty to be thankful for. Personally, I'm thankful for the hard-working Georgians who have stepped up to the plate in the recent months to follow the guidance, get folks back to work safely, partner with us as we fight every day to protect lives, but also livelihoods. I think about the educators who have adapted to a changing educational landscape to continue teaching our kids. I'm thankful especially for our frontline heroes, doctors, nurses, public health workers, and others who have gone far above the traditional call of duty, working long hours, spending precious time away from their family, many of whom will be away from their families on this Thursday. I hope that all Georgians will keep them in their thoughts and prayers and will continue to stay healthy. I'm also thankful for all those in law enforcement, our first responders, as well as our troops, including the Georgia National Guard. They have certainly dealt with unprecedented challenges and demands in recent months, never asking for recognition or special praise as they serve and protect. We all owe them our heartfelt gratitude. As governor, I know that we've got to continue to celebrate the good times, even in tough times like we're in now. And through the pandemic, it has brought tremendous loss and uncertainty, but I also believe it has shown the best in our state. So as we celebrate Thanksgiving and move forward in the days, weeks, and months to follow, let's continue to hunker down. Let's stay vigilant and resolve to act in the best interest of our fellow citizens. This holiday season will no doubt look different, but if we work together, I'm confident that Georgia's best days ahead are going to be safe, healthy, and continue to be prosperous. Thank you all. God bless. God bless you and your families. We wish you the best for a wonderful Thanksgiving holiday. And with that, I'm going to turn it over to Dr. Toomey for a few remarks.
Thanks so much. I just wanted to reinforce a few things that the governor said. We're coming on to this holiday season, Thanksgiving this week, and we've seen every time we've had a holiday that our numbers increase. Right now in Georgia, we are still lower than in other states, but we've seen a steady uptick in cases and hospitalizations and deaths. We can stop that if everyone follows those guidelines. Those 4 things for fall: wear a mask, social distance, wash your hands, follow the guidelines, and of course, get a flu shot. It's not too late. The fact that it's November does not mean we're out of the flu season. In fact, we are just going to be beginning the flu season. We've had very few cases yet. It's as important now as ever to follow those guidelines. I wanted to say that one of the things I think people have thought about is that they go get a COVID test now, and they say, well, then I can go and be with my family and not wear a mask, not social distance, not take the precautions that have been recommended, including actually this year sitting this out and taking Thanksgiving via Zoom with your family at a distance. If you get tested today and you're negative, it does not mean that you will not be positive in a day or 2 or 3. And so it's particularly important that we don't use that COVID test as a justification to go and not follow the guidelines. In the best of all circumstances, try to stay away from members of your family that aren't immediately living with you, for their own protection and your own safety as well. But if you must get together, and I know it's very hard because this is a tradition that we all value so much, please follow guidelines, socially distance, even wear a mask within your family. If possible, eat outdoors. Keep silverware separate. And if at all possible, try to socially distance throughout your visit. This is the one way we can get through this Thanksgiving without seeing additional cases and what I hope will be a healthy, safe, and happy Thanksgiving. And so just as I close, to wish you all a very healthy, happy, safe, and I hope Zoomed Thanksgiving with your family members throughout the country. Thank you.
All right, well, thank you, Dr. Toomey, and certainly appreciate you and the whole team's continued efforts 24/7 as we fight the pandemic. We're going to open it up for some questions. Obviously, we've got General King here, Director Stallings, Dr. Toomey, and myself. Before I start taking questions or any of the other folks do, I'd like to briefly just make a quick statement on elections so we can stay focused on COVID before this Thanksgiving holiday. As you all know, the President and his team requested a recount in the state of Georgia. That is now underway. I continue to stand with the President, and I support his decision to ensure that every legal vote is counted. I have followed the law, and I will continue to do so. And as stated during last week's remarks, I support a sample audit of signatures, strengthening the photo ID law as it relates to absentee voting, and I firmly believe that all voting irregularities need to be fully investigated. We should follow the law, and we should continue to put Georgians first. Over the last several weeks, unfortunately, we've seen a lot of misinformation, and more recently, quite honestly, baseless attacks that are absolutely absurd and accusations made against myself and my family. These are ridiculous. They only seek to breed fear, create confusion, and sow discord amongst our citizens. Now more than ever, we must stand up for the truth, and we have to unite around our shared values. We must ignore those that want to divide us and find a way to overcome the challenges that we all face together. I'm committed to doing that, so thank you, and I'll be glad to open it up for some COVID-related questions. Yes. Well, I'm glad to let Dr. Toomey speak as well on this. I would say that we have seen historically with COVID, which is not a long history, but we know that after these holidays, and especially when people let their guard down, that it creates bumps or spikes. And we're certainly, seeing a bump now. I think the good thing for us with where we are now, our guidance hasn't changed in a long time. So the guidance was the same basically in July that it is right now. So it's our people, the people of this state that did what we asked them to do. They were part of the solution, not part of the problem, to drive our numbers down, to drive our hospitalizations down. We've seen that with, as we continue to reopen our state, we had folks going back to school, more people going back to work, and we were fighting to protect lives and livelihoods, that we've seen an increase in cases. Thankfully, when you compare us to the rest of the country, I'm ecstatic that we're where we are. I'm also concerned at where we could go if we don't have people follow the guidance and best practices, especially over Thanksgiving when they're traveling, when they're going to consider having larger family gatherings. So we want to do just like we did, going into Labor Day. We asked people to follow the guidance, and we didn't see a huge spike after Labor Day. We've prepared our hospitalization plans and our responses, our PPE supply that Director Stallings has been working on. We are prepared to handle whatever comes our way. We want this to be a bump, not a spike. And that's what we're seeing right now. So we're urging everybody to stay focused over this long weekend of just be smart, use good common sense, get outside when you can. If you're having to be inside, try not to stay around people too long. Distance yourself, wear your mask, and we are very well prepared to weather whatever storm may come.
Hey, Governor, Andy with
Dr.
Live to
Toomey,
Live.
did you have anything you wanted? You good? Okay, yes.
Governor, I have a question for Dr. Toomey about the
Okay.
vaccine deployment. Dr. Toomey, once the FDA approves the vaccine, what's the state's role in getting it out to the public here in Georgia? About how many vaccines do you think we'll get? Who gets it first?
Yeah, no, we have been working with General King, but also with CDC very, very closely. Our plan mirrors the pandemic flu plan that we had in place in 2009, 2010 in Georgia, and we are following to the T the CDC guidelines for the priority populations, and we'll be moving in waves over time. Exactly what our vaccine amount, I think, is still to be determined, but we are prepared. We have our staff on the ground ready, and we'll be ready to go when that happens, and we hope it will be as early as mid-December.
And just one follow-up question. Once we start getting the vaccine, do you know if businesses or schools can require students and employees to get that vaccine before returning?
Well, at this point, we are not mandating this vaccine because it's an EUA. It's an emergency use authorization vaccine. And I think when it becomes a fully approved vaccine, I think that's something that will have to be taken into consideration. But at this time, that is not even on the table.
Let me just say this on the vaccine distribution plan. I had a great update meeting this week with Dr. Toomey, General King, and the rest of our team that's been, they've been working on this for months, and I just want to let General King give you a quick update from the overview of the meeting, building off of what Dr. Toomey said.
Good afternoon. My name is John King. I'm Georgia's Insurance Commissioner, and the governor has tapped me to coordinate with all the various departments in our state to make sure that we have a seamless transition between CDC and FDA and the logistical support required to sustain. So the plan, the federal government has been unprecedented. Operation Warp Speed, General Gus Perna, who's leading that part of that effort from the federal government, it's been unprecedented in the level of detail. The challenge right now, our plans mirror what the federal government has asked us to do. Dr. Toomey and an incredibly talented team has submitted that plan to the federal government. CDC has approved Georgia's plan. And right now we are fine-tuning the locations across the state to make sure that we take into consideration the vulnerable groups of our community, the folks across the state. Is geographical, but also, we know we're going to have a limited number of doses initially available, and we're working through those numbers. Right now, we don't know that exact number, but we are working through the system to make sure that those vaccines are delivered so we can take care of the most vulnerable members of our communities. Those folks have been locked down since March. Please also, pay attention to what Dr. Toomey and the governor has asked us to do. Dr. Fauci recently said, when you're waiting for the cavalry to arrive, you double down. You double down in the things that you need to do to protect your force. As a cavalry officer in the military, that makes a lot of sense to me. So we can't just, because we know that the vaccine is waiting, it's coming, we can't let our guard down. And so but we have to take care of these limited doses that will initially come to us, to the most vulnerable members of our communities. So we're working with Commissioner Berry and his team, with DCH and the Public Health Department, and also our partners at GEMA, who are going to be the cornerstone of our distribution plan.
And I'll just say this too about vaccine. Once we can get through the Thanksgiving holiday, we really want people to focus on following the 4 things for fall, to make sure that we don't see a big spike, that we can get on the backside of this little bump that we're having now. But we're going to continue to message on the vaccine distribution plan. So we're going to be talking a lot about that in the days and weeks to come, and you'll see a lot of John King, Dr. Toomey, myself, and the rest of our team as well on that. Okay.
This is a question for Commissioner Toomey. Commissioner Toomey, can you talk about now with the state statistics with the antigen and the PCR tests, how you are judging where we are? It seems that when you combine those numbers, that the number of infections is very high, that it has grown about 80% since the beginning of the month. But it seems like the positivity rate is no longer a useful guidepost. Can you talk about how you judge where we are?
No, we're looking at all of those things. Thanks for asking that question, because that's something that we assess, and we assess by county. As a collective, both the positive PCR as well as the antigen, which are presumptive positives. And just to be clear, those antigen positives are dealt with just like any other positive. We do contact tracing. We follow up those contacts. You may be aware, because of the increasing numbers nationwide, CDC recently came out with some additional guidance about case follow-up to really focus on some of the highest risk settings to do contact tracing. We aren't quite there yet in Georgia, but when we reach that point, we will follow those guidelines as well. But we look at the comprehensive positives, both the PCR and the antigen, and those are on our website as well, but they are followed up just like any other positive.
With that said, do you believe that positivity rate on just the PCR test has any use anymore?
We look at that by county, combining both, but they are right now calculated for the PCR. If you look at what's happened, actually, it's been interesting over the last week or so. The number of tests have gone up dramatically, and our percent positive has declined, even though we know we're having increasing cases. And what that is this Thanksgiving increase in testing and a demand for testing that I briefly talked about, that it's important that we don't get a false sense of security that we get tested and then go off traveling. Many people will have traveled to other areas of the country with much higher rates of COVID, and again, the concern is always that they may bring that infection back. So I think it's important to look at that. We are looking at that as part of our comprehensive approach to how we graph that, and we are following the guidelines of CDC and other states to see how we incorporate those two measures together, not separately, but comprehensively look at it. I do want to say actually one more thing about the vaccine. Once the vaccine is rolled out, initially to vaccinate the vaccinators, but also for the most vulnerable, we can't stop remembering these basic public health measures that must continue until everyone is vaccinated. And I think, again, there's this false sense of hope that, oh boy, in December 15th, we're going to get this vaccine and people will start getting vaccinated, and we can just forget about wearing a mask and socially distancing and washing our hands and all the things that I know everybody is tired of hearing me say, but we have to continue that throughout the whole vaccination campaign, which will likely go through much of the spring and summer. And I am confident by this time next year, we will have we'll be in a much better place with a state that's vaccinated, and I hope we'll have the whole pandemic more under control at this point, not just here, but throughout the country.
Governor, just a quick follow-up. Sorry, I didn't know the mic was here, sir. You're doing a good job of getting the word out and getting the message of people to follow the 4 things for fall. But the airport management yesterday said they expect 1 million people to fly between now and this Sunday. How concerned are you that people aren't heeding the message and we will see a spike versus a bump?
Well, I think for the most part, I mean, it's kind of, we'll see after a holiday weekend. I know in my discussions with senior executives at Delta I heard John Zeldin on the radio yesterday talking about the precautions and the sanitation practices that the airport's taken. People that have been traveling, you know, they're seasoned business type travelers and other folks. I don't know that we've seen, I mean, Dr. Toomey can correct me if I'm wrong, but I don't know that we've seen any problems with people traveling around the country and around the world. In fact, we've had, you know, Pat Wilson, Department of Economic Development, has been over to Europe several times on economic development missions following Dr. Toomey's guidance and testing regime before and after, and like there's been no issues with that. Obviously, when you got a lot more volume in the airport, you have the opportunity for that, which is why, you know, I said in my remarks, people have to really pay attention to socially distancing themselves if they're going through the airport. I think the airlines have done an unbelievable job on the way they're recirculating, filtering, and cleaning air and the surfaces on the airplanes themselves. Their employees have done a great job, so I'm not too overly concerned about it. I don't think it's going to be any worse than having a lot of people that were traveling, you know, over July 4th weekend or Labor Day weekend that were, you know, packing the coast or state parks or anywhere else. But people, if they follow the guidance, you know, we can help limit the spread. I mean, it's a virus. It's going to spread. We're not going to stop it until we get the vaccine and we continue to just keep the fight for, you know, months ahead. But we can limit the spread if people are following the guidance. And I think that they'll do that in the airport. I mean, the airlines have policies on folks that are flying on their planes, and I know that the airports do as well. So I am cautiously optimistic for that. But I would urge, you know, any families that are traveling just to wear your mask, stay with your group, get in there, get out of there, and have a happy and safe Thanksgiving.
Governor, we got the latest White House Coronavirus Task Force report this morning. As you mentioned, it says we are doing better than many of our peer states. However, the trend lines look kind of ominous. And it says that now is the time to take greater steps toward mitigation. You haven't really announced any new steps that the state is going to be mandating. Why not? And do you think any are necessary? And what would need to take place for new steps to be put into place?
Well, I don't see any reason to take any additional steps right now. As I spoke earlier, we've got plenty of capacity. We're in constant communication with our hospital CEOs. We're watching, you know, not just one number, but every number daily. Dr. Toomey and her team is, and I am as well. Our guidance is the same, you know, that it was in July. It's the same that it was, you know, before kids went back to school and after, when we didn't see any sort of an issue. And it's the same that we're seeing right now as we've had, you know, this little bit of an uptick. But make no mistake, we're not seeing a spike here right now. We don't want to see one. That's why we're urging people to follow the guidance. You're also seeing, you know, other cities and states that have been locked down constantly that are also facing threats right now. Parts of New York, we're talking about San Francisco the other day. I mean, it's a virus. You know, we are taking the take in Georgia that we have good public health guidance, that Dr. Toomey and her team and a lot of other people have worked very hard on so that we can protect livelihoods, but also lives against the coronavirus. And that's what we're continuing to do in our state. And I don't think anybody on our team's at the point now that we need to consider anything other than what we have in place. Our citizens are the ones that solved the problem after July 4th, because people did what we asked them to do, and we're asking them to do that again going into Thanksgiving. If we do that, we're going to get on the backside of this little bump that we're seeing, and we're going to be closer to getting the vaccine distributed and distributed and people getting vaccinated.
Governor, on your election comments, the Secretary of State's office has not ruled out the kind of signature audit that you'd like to see. They do say there are questions about how it would be done, who would do it, who would pay for it, and barring any specific evidence that there's been some sort of signature fraud, they're not sure, they're not ready to proceed. Do you see specific evidence that would warrant that step?
Well, happy Thanksgiving. and we want to stay focused on COVID going into Thanksgiving. I'll refer back to my original statement. I've been very clear about what I would like to see, and I'll leave it at that. Any other COVID questions?
I'd like to reinforce Dave's question about specific evidence regarding fraud.
Happy Thanksgiving to you as well. Anything else on COVID? All right. Thank you very much.
You've been listening to the governor of Georgia and his coronavirus task force. The governor saying that Georgians must be vigilant. So what we as a state are experiencing right now in terms of rising case numbers is a bump and not a spike. Dr. Kathleen Toomey said that each holiday during the pandemic, Georgia has seen the number of cases, the number of people in the hospital, and the number of deaths go up. So a real urgency now, she says, for people to take every precaution possible. That is wearing masks, socially distancing, limiting the numbers of people in a group, because the numbers in our state are already going up. Insurance Commissioner King said it's time to double down, he said, on masks, limiting exposure. He said, while we wait for the cavalry to arrive, wait for the help, and that is the vaccine. Dr. Toomey says she's concerned about a false sense of hope in the vaccine. While it is absolutely hopeful, what she was meaning is that widespread distribution is going to take time. She said through spring and next summer, so continued safety measures are critical to protect yourself and others around you until that vaccine can be distributed throughout the entire state and throughout the country. So a lot of new information to go over with you today. We'll have much more on 11 Alive at 5 and 6, also on 11alive.com. And for those of you looking for Days of Our Lives, it will re-air for you in its entirety at 3 a.m.